Liberal Viewer present.
So I was very interested to see Michael Moore give his first live interview in over 2 years to HBO's Real Time with Bill Maher last week, and even more interested in Michael Moore's new movie Sicko, about the U.S. healthcare system, which Moore described this way.
It's about how the health insurance industry essentially is running a racket. And because they have to maximize profits for their shareholders, the only way that they can do that is by screwing their clients, trying to deny them coverage, kicking them off the rolls, not paying doctors claims that are sent in. I mean, a whole bunch of things that they do that make life miserable for so many people. And between them and the pharmaceutical companies who are just ripping everybody off right and left, these two industries are essentially the vehicle in this film that I use to tell maybe a larger story about who we are as Americans and why are we the only Western industrialized country that doesn't have free universal health coverage. It's absolutely insane, I think.
Now, the insanity of the U.S. healthcare system has been documented factually for a while. Back in 2004, for example, Health Affairs published 2 studies, to which I'll put links in the video description, showing pretty definitively that the U.S. spends a lot more on healthcare than other industrialized countries, but ends up with about the same quality of healthcare as the other industrialized countries. Or, if you prefer absolute quality to comparative quality, check out the link in the video description to the 2003 New England Journal of Medicine article showing that, on average, adults in the U.S. get little more than half the care medically recommended for their conditions. I'm particularly confident in the results of that last study because my older brother is one of the co-authors. Unfortunately, this particular threat to America's health will not be solved scientifically by great research scientists like my brother, but instead must be solved politically by American politicians driven by American voters. And sometimes it takes a great cultural moment to create political action. 100 years ago, a best-selling muckraking novel by Upton Sinclair titled The Jungle led to real reforms in the U.S. meatpacking industry he had so excruciatingly described. So perhaps Michael Moore's movie Sicko, opening at the end of June, may have the makings of a movement motivator, as exemplified in this stunning endorsement.
Even Fox News said it was brilliant and uplifting. Now, Mike, the right wing still hates you, don't they?
Yeah, I haven't quite recovered from that comment yet from Fox News.
How did you win over Fox News?
You know, it premiered in Cannes this past week, and there were a lot of Americans in the audience. And in fact, afterwards, a couple of Republicans came up to me and shook my hand and thanked me for making the film. And one of them started tearing up, and I thought, geez, I've made a film that that some of them, I think, will listen to.
So maybe they really will listen this time on this issue that should reach across party lines, as Michael Moore himself suggests here.
Illness and sickness doesn't know any kind of political stripe. This affects Democrats and Republicans, and we've got a huge greedy industry in this country, and there should be no room for greed when we're talking about people's health, and that has to be removed, and we've got to get rid of these profit-making insurance companies.
So what do you think? Will Michael Moore's new movie Sicko be the final impetus pushing the people of the U.S. to fix the national healthcare system? And whatever you think of the effect of Michael Moore, will the 2008 election cycle finally elect a U.S. president and a U.S. Congress that can find a way to provide universal health care for the American people?
I YouTube, you decide.
All right, how do you feel about healthcare in America today?
I think it's pretty poor these days. A lot of people can't afford it.
And in your opinion, what country has the best healthcare?
I'll probably say Russia because they really don't have to pay for it out of their pocket.
And so, having to pay out of pocket for your healthcare, do you feel that that's fair or unfair?
Well, compared to other countries, I think it's unfair. But over here, I mean, the economy and all that is pretty fair.
And so, if you could change the healthcare in America, what would you do? If you could do anything to change the healthcare in America, what would you do?
Try to give more people money, make it free. Sorry about that. So everybody can have it, make it free, help people out. So.
All right, thank you. All right, appreciate it.
Arianna Huffington is the co-founder of the Huffington Post, one of the most widely read news websites in the US. And I asked her if some of the more outlandish claims about Obama being the Antichrist and the death threats that have been circulated actually help supporters of the president manage expectations of what the Democrats can actually achieve.
I don't think anybody likes that. I think everybody who cares about America and cares about our democracy knows that you can have passionate disagreements, but when they veer into the land of fantasy, it's very dangerous for the democracy. That's why, you know, in our Constitution, we have exceptions to the First Amendment that have to do with yelling fire in a crowded theater. Now, I'm not suggesting that there are any restrictions to our free speech, which is pretty sacred in this country, but it shows why there were exceptions, because words do have consequences. And right now we see many manifestations of violence. We see bricks being thrown through congressional windows and threats of assassinations and all those very dangerous indications that people, when they're afraid and anxious, as they are in this country at the moment, believe a lot of outlandish things.
But as far as the effect on actual policy is concerned, it is striking how what is fundamentally a very non-radical healthcare reform bill is being hailed by the liberal establishment. It still leaves 25 million people uninsured. It puts more money in the insurance companies. It has the threat of bankruptcy or jail for the poorest in society. It discriminates against women and the elderly. And this is being hailed by the liberal establishment. How low are your expectations right now?
Well, first of all, you know, I have written quite a lot about how deeply flawed the bill is and how it does make way too many concessions to the pharmaceutical industry and the health insurance industry. But it is definitely a major first step away from a very broken status quo. And the fact that the health insurance industry was fighting it tooth and nail towards the end is proof of that. But this is really the first step, and it's being acknowledged as being the first step that needs to be improved, that needs to be made much better, and that needs to deal with issues like prevention and other factors that are critical for cost containment.
But I mean, what this says about the Obama administration to some is, yes, you know, he can get these things through, but they're deeply compromised, and those on the progressive side of the argument are too frightened really to fight him because they're worried about the alternative. This is just going to embolden Obama for perhaps more, and the Democratic Party for more compromises. There's already wishy-washy language on immigration reform and financial regulation and so forth. This is the status quo. It just has a different face.
Well, there is no question that right now lobbyists and campaign contributions are having a major impact in both political parties, and we'll see when it comes to financial reform how bold and significant it's going to be. And I agree with you, it's very important that there is real financial reform, that there is a real jobs program beyond the $15 billion bill that was passed by the Senate, because right now the greatest danger in America is that the middle class is crumbling. With so many people out of work, so many people's homes being foreclosed, so many bankruptcies, we are having an unprecedented situation in America where there is downward mobility instead of upward mobility, and that has deeply, profoundly troubling consequences, both economically, politically, and even psychologically.
Right, but I suppose there were similar comparisons to be made on you know, a for-profit healthcare system and the trouble that was causing, and yet this is the compromise we got. And from a foreign policy angle, there are parallels too for many of these marvelous speeches from Obama, these marvelous aspirational goals, but then in the end we get a rather reactionary platform of a rather neocon agenda for Iran, escalation of the war in Afghanistan, rewarding coup plotters in Latin America, an almost masochistic ability to be insulted by the Israeli Prime Minister. Again, we wonder whether it's all talk and it just leads to the same old status quo of American foreign policy in this case.
Well, there's definitely been a dramatic shift in the policy towards Israel. I mean, after all, As you know, George Bush did not leave any daylight between his administration and the Israeli government, and here there is a very clear difference when it comes to the settlements. What I would argue is that the administration's policy on Afghanistan is extremely misguided, that in fact, especially because of the civilian casualties, the unintended consequences of our policy there, we are making America even more deeply unpopular in the region, and therefore we're exacerbating the tendencies in the region that are very destructive for this country.
How do you feel healthcare in America is, like the status of it right now?
We don't cover enough people, that's obvious. We've got a lot of people who are without coverage, and even with Obamacare, we're still going to have people without coverage.
And so, if given the chance to fix the healthcare, what would you make different? What would you do different?
Well, I don't necessarily want to go to a total welfare state like they have over in Europe, and yet, you know, I don't really know how to fix the healthcare system. I know that it needs fixing. I have to sit down and study the problem, find out what's contributing to the lack of healthcare. I think one of the problems that we have is that we don't educate the kids enough about how to take care of themselves so that they don't wind up in trouble health-wise.
And so, in your opinion, which country do you think we should model our healthcare after? Who do you think has a pretty good healthcare?
I don't think anybody's come up roses on that one. There are some countries where they take care of you cradle to grave, like Sweden. There are other countries where they put an awful lot into the national health care, but it's going bankrupt, like England. This is not an easy question. There is not going to be an easy fix. And that's just the way it is. You're going to have to sit down and try a few things.
Thank you.